Well, I am at about 36 hours post-op. I went in for my trigger finger, um, re, um, I don't know, chiseling off my nodes on my finger, my middle finger, and then there was also uh, a CMC joint reconstruction. So I had my CMC joint in my thumb taken out, and then the anchovy procedure, which is rolling up a tendon, taking a tendon out of my wrist or my arm, and rolling it up under and into the place where the CMC joint is. And then I also had a tendon released a little bit because it was too tight down in my arm. So I had about 4 procedures done on June 20th, which was yesterday. I went into surgery about 7:30 in the morning. Check-in was at 6. I came back. I think I ended up back in recovery probably about 10:30, and then I got home about maybe 12:30, quarter to 1 in the afternoon, and now it's about 8:30 the next day, 8:30 p.m. And I have been good about putting ice on my arm to keep the swelling down and the pain down. I've been taking oxycodone and Percocet every 4 hours. I chose to miss two, my 3:30 in the morning and 3:30 in the afternoon. I just chose to not take it, and just to see how I would do. The nerve block, I think, is pretty much all gone now today, because I'm wiggling my fingers the best that I can, and I can pretty much feel all the insides. My wrist, my arm kind of hurts a little bit, I think, where he did the release on the tendon. I am taking a CBD and THC mixture in the evening time before I go to bed to just help relax my body. They're drops, relax my body, and be able to help with the pain as well. I slept pretty well last night, except for I think I was up more than I was asleep because I had to go to the bathroom so much. Because I am drinking like 90 ounces of water. So I'm trying to stay hydrated. I'm walking outside to try to get, movement, because when you move, that brings blood flow, new blood flow to the area. But it hurts some, not not bad right now. Everybody that I've watched on YouTube have said the third day is probably the hardest, but I also told my surgeon that I expect the pain to be 12 out of a 10, and that I don't expect to have full mobility in my hand without pain and without thinking about it for 6 months, and not to be fully recovered, just not thinking, oh, I'm using it, and not even thinking about it for a year. And the reason I say that is because I've had shoulder surgeries, and they've cut my collarbone. And bone, when they do anything with bone, it's the most painful. It's worse than childbirth. And when they did that, I wasn't prepared for my shoulder pain the first time. And because I didn't know anything. Well, now I've gone through it, and I know what kind of pain that's going to be. So I'm already going into it knowing that this is going to be very painful, and I'm not going to try to be a hero or a martyr and go without pain meds. I will take the pain meds for as long as I feel like I need to, but I am trying to use other means, like the CBD and THC mixture, to help also mitigate pain. Um, I also will take some ibuprofen because the oxycodone has Tylenol, so I'm not going to be adding any more Tylenol. But I know that 20 minutes on and 30 minutes off of a gel pack, ice pack on my arm, um, on my skin part so that it radiates down my arm, that also helps with pain. And I learned that with my shoulder surgeries and my back surgeries. So I feel like I'm prepared, and I'm not going into it thinking that I'm going to be feeling good in the next, couple of weeks, because I'm not. Um, and I just have to be careful and not overdo it. Because I've tried to, pinch my fingers together, and I can feel that, and it reminds me, oh yeah, I had something done. So it helps to remind me to not overuse it. Um, so I just wanted to give an update for myself to remind myself that where I'm at 36 hours, and or approximately maybe 34, and then to know that things are going to get better. And this short-term pain was for the benefit of the long-term gain of no pain, and being able to use my hands again, because I was not, I was driving and it was hurting to drive, and it's hurting to open up doors and open up jars. And this is my left hand, and I have the same thing going on in my right hand, but that's not going to happen anytime soon. Um, so, anyways, so if anybody is trying, to wait it out, I feel that quality of life is better than quantity. And if I can't have quality of life because I'm in pain, then that means it's time for me to do something. And it was waking me up at night, and I wasn't having a good quality of life. And I'm 62 years old, and I knew that Medicare wasn't going to be a good option for surgeries. So I felt like I've dealt with this for over 6 years in this particular hand, and tried many other options, and it's not getting better, it's only getting worse. And that's what osteoarthritis does. It doesn't get better, it only gets worse. When it's bone on bone, it hurts. So instead of putting it off, I decided it was now time to have intervention. And I'm really glad that I did it, because the pain was getting more and more and more, and I was splinting and everything, and nothing was helping. And so I knew that this was the right time. And right when it was um, almost the day of the surgery, it was like I was almost in tears almost every day because it hurt so much. And nobody knew, because I just didn't want other people to really know about it. I just kind of dealt with it. So, anyways, that's my update, and I will try to do periodic updates to give you an idea. I will be getting this particular cast off on July 3rd. That's my follow up, and we'll look at what's going on then. So, that'll be about 10 days or so after the surgery. So, that's the end of this story of day 1, day 2 of my surgery.